Everyone, and welcome to today's Facebook Live with GBMC Healthcare. Today we are talking about GBMC's response to COVID and cancer. So let's welcome our guest, Dr. Robert Brookland, Chairman of Radiation Oncology at GBMC Health Partners. And remember, we want to hear from anyone watching. Please don't hesitate to ask us your questions. So welcome, Dr. Brookland.
Well, thank you so much for inviting me this morning.
Thank you for being here with us. So explain to everyone your role at GBMC.
Well, you said that in the singular. So I am the chairman of the Department of Radiation Oncology at Greater Baltimore Medical Center. So in that capacity, my role is both to make sure that the healthcare being delivered in the Department of Radiation Oncology is of the highest caliber, safe and sound. And I see a lot of patients, so I'm treating patients individually as well as supervising the department in terms of healthcare. I have other roles at GBMC, which include serving on the healthcare board, which is responsible for making sure that the whole healthcare system is giving the best possible quality of care for our community.
All right. Well, thank you. I already know that you're a busy man, right? Wearing a whole lot of hats. So talk to us about the current visitation policy there at GBMC.
So initially, when the pandemic first made its way into Maryland, we slammed on the brakes. We wanted to make sure that everything was absolutely safe without letting the infections overwhelm what we could handle. We weren't letting anyone in. We stopped all elective surgeries. We really went extreme to protect staff and patients. And then as we were able to increase our testing capacity to acquire the more of the needed equipment, PPEs for everyone, and institute safe policies, we were able to start to liberalize things. So at this point, the visitation policy has loosened up some. It's a bit different for those folks who are coming as outpatients versus who are coming as inpatients. So right now, if you're coming as an outpatient and you need to have someone with you to accompany you for assistance, although we prefer there not to be any visitors, but if someone needs the help of someone, then that's generally permissible. But anybody coming in needs to be screened. We're asking people questions about symptoms, and we're checking everybody's temperature. On the inpatient side, it does vary by the situation. Again, we prefer there to be no visitors, but there are certain situations where that's just not appropriate or reasonable. In child care delivery or emergency surgery are examples where there are others where someone can have a visitor. And because so many situations are unique, given any unique situation, you want to check to see if a visitor is okay.
All right. So we talk a lot during COVID about people with compromised immune systems, right? So talk to us about what's being done to keep people safe within the Cancer Institute there. Right.
So we know that there are certain folks who are more susceptible to getting especially ill if they develop the COVID-19 disease, the infection from the SARS-CoV-2 virus. So pretty much anybody can contract the disease. A fully intact immune system can still contract the disease, but there's such a wide response of reaction once you contract the disease. And that response can range anywhere from completely asymptomatic to very mild symptoms that you may not even put much attention to becoming profoundly ill. And this virus can affect multiple systems, not just the respiratory system. So at-risk individuals will be those over age 60, especially with other medical conditions in addition to the age. But cancer in and of itself does not mean you're more likely to get into trouble from the virus. Not everybody with cancer has a significantly compromised immune system. Some may. And then the treatments for the cancers, depending on the treatment, might also make one more susceptible. So treatments such as certain types of systemic therapies or chemotherapy, which lower the blood counts. The white cells are the element that's responsible to help fight infection and influence our immune system. So treatments that lower the white cell counts could also have a negative impact on our immune system. So enough of our patients, whether it's from the disease or from the treatments, may have a somewhat compromised immune system. So we do need to be factoring that into decision-making and management.
All right, so let's say that someone was recently diagnosed with cancer in the past several months. Should they feel safe to start or even to continue their treatment during this time?
Right. So I have to give a lot of credit to Governor Hogan for responding promptly statewide to help to dampen that curve and prevent the surge that we were so concerned about early on. And that actually is what happened in Maryland. Although for the last several days, there has been a tick up again in the cases in Maryland. But in general, we've been seeing an ever decreasing number of inpatients. We've been seeing less number of patients in the intensive care unit or on ventilators. So because we've been seeing a decline in the caseload in the state and the severity, we have been able to resume things pretty much on track for the vast majority of our cancer patients. Initially, we were looking for strategies to safely delay treatment or be a little bit more strategic in how we would sequence one form of treatment with another in order to delay things. I'll give you an example. I treat a lot of patients who have cancer of the prostate.
Okay.
As a general rule, cancer of the prostate can fall into two categories. Men who have somewhat lower risk prostate cancer and men who have a somewhat higher risk prostate cancer. The guys with the lower risk cancer, we could safely wait. So in March and April, we were waiting. Now we're not. We're able to move forward.
Right.
For guys with the higher risk cancer, I was having them start on hormonal therapy, which would suppress the disease, kill some of it, and buy us additional months. And I said, we'll resume things with other treatments when the environment gets safer, which it now is. So these guys are all back on treatment at this point. Other forms of treatment where you could sequence surgery or systemic therapies and whatnot, you might elect to go with the systemic treatments first and delay them coming to the hospital for surgery. But we no longer have to use those kinds of strategic sequencing strategies to keep our patients safe. So for the most part, the current virus situation in Maryland, thanks to the hard work that people are doing with social distancing, wearing of face masks, hand hygiene, with all of the steps that have been taken, the sacrifices that everybody's made, closing down many of the businesses for a while, etc. The numbers have come down. It's safer. We can test better. We are not delaying treatments for the vast majority of patients at this point. It's
so
safe.
Talk to us again. You mentioned some of the mandates in Maryland and seeing the numbers go down, and then you said face mask. Can you talk to us about why it is important to have a face covering for yourself and for those vulnerable patients that you talked about?
Okay, well, that's a great and an important question. To understand the answer to the question, you have to understand, how does this disease get transmitted? And typically the answer is by way of the oral cavity, through the nose, or maybe through the eyes. And and the disease can be transmitted then either through micro droplets if it's in our respiratory system, if we cough, if we sneeze, or just in speaking, micro droplets can come out, and there can be viral particles there. Mm-hmm. And these particles can travel for 3 feet or more. So the first concept is, since there can be viral particles initially in the air, that's why we're recommending, if you can get 6 feet away, that's a good thing. Being outside, where the viral particles can be dispersed, the concentration lowered, that's a good thing. But that may not be enough, because the viral particles may still come in contact. Either we could inhale it, conceivably, or we could touch surfaces that have the particles in it. And so we're then bringing it to ourselves by bringing our hands up to our mouth or our nose or our eyes. So wearing a mask is actually really helpful in stopping the microparticles from coming out as we breathe or speak or cough or sneeze. So when we wear masks, we're protecting others from our microdroplets, right, which may have those viral particles, even though we don't know about it, projecting out and getting to others. And let me give you a little anecdote. Earlier this morning, I was administering some radiopharmaceutical treatments to a number of patients whose cancers had spread into the bone. Mm-hmm. My nurse, who has 2 young children, told me that she just tested positive for antibodies. Wow. She never had any symptoms. She never knew that she had the disease. But apparently she had, maybe because her young child brought it home from daycare back in February or March.
Right.
It's a lot of little children aren't getting symptomatic from the disease. And my nurse is young enough that she wasn't having any symptoms, but she was exposed. And based on those antibodies, we know that. So there was a period of time when she could have been giving this disease to other people, mm-hmm, if she wasn't wearing the mask to prevent those micro droplets from coming out. So that's why the mask is important. It prevents viral-rich micro droplets from coming out of people who may be symptomatic, and then we come in contact with it either directly into the mouth, nose, eyes, or we touch it and then bring our hands to our face.
Now, you mentioned the nurse being young, because young people is something that the governor also talked about yesterday, and the positivity rate being so much higher for people under 35 versus over 35. Can you speak to why it is still dangerous for people under 35 if they contract COVID?
So while it is possible for a young person to actually end up seriously ill, or in the ICU, or on a respirator, or even having a fatal outcome, it is possible, but as a general rule, that's not happening. However, young people maybe aren't not being as careful as they should with hand hygiene, social distancing, the wearing of a face mask, contract the disease because they're now starting to go back out to restaurants. We just had the July 4th barbecues, all sorts of ways, and that's why I think the numbers are starting to click back up again in the state, with younger people being out and about. They can contract the disease, and they're not getting into trouble from it. They come home, they give it to an older person in the home, or they're coming in contact with other people who may have some health compromises, and that's the person who's going to get into trouble.
Right.
If we care about our community, if we care about others, we need to wear a mask.
Agreed. So going back to the people that you were talking about, the cancer patients who have the compromised immune systems, and you talked about even some of them, the treatments, the way that you got creative with the treatments during this time. So do radiation treatments affect the immune system?
As a general rule, not really. Now, a lot of tests that have looked at blood counts during radiation treatment, and as a general rule, it doesn't. Excuse me for a minute, I have to clear my throat.
Okay.
No, thank you.
Mm-hmm. And so you talked about people maybe relaxing some of the strict things. I know in the beginning, right, when I went out, I had my hair tied up, I had a baseball hat, I kept my sunglasses on in the store, I'd wear 2 masks. And so I have been taking my sunglasses off. Everything else I still pretty much do. But can you talk about maybe how the people relaxing everything has kind of affected our view of what's happening with the COVID situation?
And I think that early on there was a pretty high level of anxiety. We were seeing terrible reports coming out of New York and other states where their systems were getting overwhelmed. And we understood the implications of that. So, the kids were sent home from schools, and the personal school time went away. And most of the businesses shut down unless they were essential. We really went into heavy-duty response back in, let's say, March. Things have gotten better. I think there's some kind of fatigue going on, like we're ready to get back to our normal lives. We know it's accurate that the risks are improving, and I think there's just been a psychologically understandable tendency to kind of relax and let our guard down. But if we pay attention to what's happened in, let's say, California recently, California had done a really nice job of suppressing things, but perhaps they relaxed it a little bit too much, a little bit too quickly, and they've got a fight on their hands once again. Florida, Texas, Arizona, they're getting really overwhelmed right now. We should take some lessons. There's a right way and a wrong way to do it. If you want to know the right way to do it, you don't have to look. You don't have to look much further than Canada to our north, the European Union, and you can see that we can beat this thing. But we just have to stick with the responsible responses until the risk level is down and stays down, and you can do adequate testing. So our positive test rate in Maryland is still less than 5%, which is good. But with the cases starting to creep back up again, it's a reminder we can't forget about the fact that we are still living in a pandemic.
Right. And so, Dr. Brookland, talking about the face mask and people with compromised immune systems, is there a certain type of mask that maybe
most people
issues should wear?
Most people can get by with simple cloth masks. It's just protecting those micro droplets from spreading out. So pretty much anything like this can be used very simply, placed over the nose and mouth. I get very frustrated when I see people walking around like this.
Yeah, me too.
Like this. Maybe if you're making a fashion statement, I get it. But if you're not protecting this and this from air coming out without being filtered through a mask, it's not doing anything. And I've told I'll walk into a room of a patient who's in there like this. I'll say, Mr. Jones, I need you to put that mask over your nose because otherwise you're not protecting me very well.
Right.
These masks are protecting others from your micro droplets. Now, there are some other kinds of equipment that we sometimes use. I'll just give you a little demonstration.
Okay.
So this is an N95 mask.
Oh, okay.
Yeah.
Right.
So the N95 masks are worn like that. Now, the important thing, and I didn't show you the medically best way of doing it just for purposes of what we're doing here, but generally speaking, if you're going to wear an N95, not only will this protect others from my micro droplets, but an N95 is going to protect me from other people's micro droplets. So if you have an N95 mask, and there might be a couple of other forms as well, then you are actually not just protecting others, but increasing the level at which you're protecting yourself. But we generally don't need N95s for common and everyday use.
Right.
Generally need N95s when we're in high-risk situations, which healthcare providers are typically in. And then, of course, the appropriate way when you use an N95 is you hand sterilize.
Right.
And you hand sterilize before you put it on, and then after you take it off, and following taking it off, you then hand sterilize again, because you theoretically may have touched a contaminated surface, and so you may have gotten it on your hands. And studies have shown that the number of times that a person will bring their hands to their face over the course of an hour is staggering. Staggering number of times.
Right.
So if ever, on the TV talk shows, for example, they have these Zoom things. Just for the fun of it, watch and see how well, these are trained actors. Maybe they don't do it. If you watch normal people, you'll see the hands go into the face an extraordinary number of times. And I was on a Zoom meeting once, and I just decided to count how many times people were put. There was only 6 people on this call, and I don't think a minute went by that someone wasn't bringing their hand to their face. And you do it sometimes. And so for those people who wear gloves thinking that the gloves are protective, the gloves are not protective. And the reason why gloves are not protective is so now that rather than the virus getting on your skin, it's getting on the surface of the glove. But if you bring your glove up to your face, guess what? The glove was the way in which the virus got to you. So the gloves may give you a false sense of security, and you leave your defenses down. So gloves are all well and good, but if you're bringing your hands to your face, glove or not, you're bringing the virus up to you.
Right. We've seen people eat with gloves and everything else. Well, Dr. Brookland, thank you so very much. This has been so insightful. We appreciate you for joining us today and giving us all of those tips, clearing up everything, telling everybody how to wear the mask the right way, put it over your nose. And again, for everyone at home, we appreciate you tuning in as well. Go ahead.
So just my last words are social distance, wear a mask, wash your hands, stay safe, and we will get through this. And it's safe at GBMC because we're all doing this.
Yes, we will. Thank you again, Dr. Brookland, for joining us. And for everyone at home, until next time.